Hi, my name is Cece. I'm with A21 Freedom Chasers, and I'm joined today with Debbie and Janet from the governor's office. We're still talking about human trafficking in Texas, and I'd like for the ladies to introduce themselves, and we'll go right into some good conversation.
Hey, hi, my name is Debbie Solcher, and I'm the Central Texas Regional Administrator with the Governor's Office Child Sex Trafficking Team. And I work primarily in the areas from San Antonio to Waco. There's about 41 counties in that Central Texas area that I'm responsible for.
And I'm Janet Kasper, and I'm the East Texas Regional Administrator for the Governor's Child Sex Trafficking Team. And my office is in Houston, and I work really in the Southeast Texas area. I have about 40 counties that I'm responsible for.
Great, thanks for joining me here today. We just have a few things that we'd like to just chat about, and I'll just go right into it. So we know that unfortunately Texas is the highest ranking state in the US with trafficking issues, and we just kind of want to get your thoughts and opinions about that, and maybe some work that is going behind what you do every single day to address that.
Okay, so we have a really robust strategy around commercially sexually exploited youth in the state of Texas that we have around the five Texas 5-point star. And so those strategy areas encompass protection, recognition, recovery, restoration, and then bringing justice for victims and survivors. And so we'll just maybe kind of give a little bit of information about what the team is doing around each of those star strategy areas. And so the first one is protection. And so we fund Boys and Girls Clubs prevention education programs, as well as Love 146 Not a Number, and train a lot of educators and counselors that are dealing with high-risk youth on the Not a Number education curriculum for prevention. We also have a CEASE program, which is Cities Empowered Against Sexual Exploitation. And that is a partnership with Children at Risk in Houston, Texas. I don't know, Janet, since that's in your area, if you want to describe more about CEASE.
Sure. Yeah. So that's a great program, really targeted at the demand side, as Debbie said. And so they actually put out some decoy ads, and they have conversations with would-be buyers. So they would pose as sex sellers, and buyers would then begin to solicit them. And then they would begin to talk to them about, do you really understand what you're doing? Do you understand the consequences of this? Do you understand that this is trafficking? And we've seen some really great things come out of that. And so that's something that we're really proud of. And certainly it launched in Houston, but also it's happening in 5 other cities across the state, or 5 total across the state. Although I think it's about to expand out in Southeast Texas. And they really target the areas where we know there's a lot of online sex buying.
Mm-hmm. And I know they also are working in the Travis County area and the Bexar County area. And then I believe there's one, is it in Dallas?
Yes, Dallas and Galveston as well. And then far southeast Texas, Jefferson County, they're about to begin a program out there as well. And then did you say West Texas? So out in the Midland area as well.
Did you have any other things that you would like to add around our protection star strategy?
Yeah, so definitely doing just a lot of education to build up a resiliency to trafficking for those kids who would fall at high risk, but then even just supporting curriculums and programs locally kind of throughout the state who do great work at educating parents.
That's great. I know you all have a really good website that offers lots of resources for parents and just any individual who's interested in knowing more about what's happening in Texas, right? We have such a huge state. So I'm sure you all know about the different areas that all need to be covered. So tell us a little bit more about what someone could find on your site?
We have a lot of really great research that's updated every quarter, if not more. And we also have pre-recorded webinars access that we've done for the last year. And I believe you can sign up for our newsletter on that site. That goes out quarterly. We have lots of information about our partnerships. And Janet, any other information that I'm missing?
Yeah, so, and a lot of just links for great websites that we feel like have really good information and good tools out there. So we have those listed on our site as well. And as Debbie said, some of our partners. So you could go to our website and look really at every point of our star, so to speak, the prevention and recovery and recognition and all that, and click on that link. And that will take you to some information specific to that area. And so I would say it's a website that's really great for any audience, whether it's a service provider or a parent or a teacher, because it's going to educate you in all different areas.
Mm-hmm. Very, very robust information. And we also, in addition to Janet and myself, we have several other peers that are working around the state doing the same thing that we're doing. Unfortunately, they were unable to join us today, but we also have regional administrators in the West Texas, North Texas, and South Texas areas. And so all of our contact information is there. So if someone were to get on the website and need information about a particular region, they could access our information there and reach out to us.
That's great. That's great. So how long has this strategy been in place?
So we launched, the team actually was created in 2015 out of legislation. And so our director was hired in that year, or actually appointed by Governor Abbott, Andrea Sparks, in 2015. And then she began to bring her team together. And so I would say in 2016, as she began to hire some of her leaders, Alan Schonborn and Todd Latiotis, who were working on strategy and policy and prevention things, then they began to kind of strategize, and then they brought us on as regional administrators. And so I would say probably end of 2016, early 2017, a strategy was birthed. And it's continuously evolving because we're learning a lot of things. And one of our core values is to be continual learners, because we want to make sure that whatever we put out there is effective and it's sustainable. So we're pretty new at this, but here we are in 2020, and we feel like we have a really strong strategy now, and we're rolling it out across the state with some great results.
And to follow up on what Janet was saying, as part of that initial grouping of what we needed to accomplish after we were legislatively mandated, there were lots of conversations with various task force summits around the state with our major partners, DFPS and TJJD, in order to figure out what we needed to have for our mission and vision and guiding principles. And a couple of those things that are really important to us are that we're survivor informed, that our partners and the systems that we work with are trauma informed in order to assist these youth with the complex trauma that they're dealing with. And so all of these strategies were born out of conversations that occurred with those groups. So we have spent a lot of time and work very consistently in always gathering new partners along the way, as far as statewide systems, governmental agencies, non-governmental agencies, other community partners. And so I feel like, as Janet said, we have a really great reach right now with all the communities around the state in trying to combat this.
That's wonderful. Yeah, I can definitely say that I've seen that progress, and it's very reassuring as someone who's on the side trying to fight it, right, and to see the state leading that is extremely empowering. Have you all seen any kind of change or anything with the way human trafficking looks during this time that we're in, like this pandemic that we're in?
We have, and I'll tell you a little bit about our recognition strategy, because that's kind of the next one in the 5-prong area, and then I'll let Janet kind of follow up with that particular question. We know that these youth don't generally walk up to you and say, "I'm being exploited." So we partnered with West Coast Children's Clinic out of California to bring in a validated research validated tool called the CSTT, which is the Commercial Sexual Exploitation Identification Tool. And we regularly train lots of agencies around the state who deal with high-risk youth on this tool. And so far to date, we have screened over 25,000 youth in the state of Texas, which is amazing. And we're continuing to train more people as we gain new partnerships. Part of the research that came out of that validation tool, which is a universal screening tool, meaning it can be used with anyone, it's not male or female oriented, it's for both sexes, ages 10 to 17, although it can be used outside of that, but the youngest child that was validated in the study was age 10. And so 75% of the youth that were part of this validation study did not see themselves as being exploited at all. 75% of those youth also had been exploited for 2 years or more before any exploitation anyone was aware that they were being exploited. And then 50% of those youth were 14 years or younger at the time of their exploitation. So we know that we have to be looking for these youth, because if we don't look, we can't see them. And I promise you, they're next door to you. They're sitting next to your child at school. It is in your neighborhood. It is everywhere. So I'll let Janet take the question about the online piece and what we've seen now with COVID particularly.
Yeah. So again, we're rolling out the assessment tool, as Debbie has said. So it'll be interesting to start looking at our data to see as we're rolling it out and kind of compare it to pre-COVID, post-COVID results. And we don't have that yet. But I will say that our ICAC teams, Internet Crimes Against Children across the state, are inundated with cases that they are working on. They're overwhelmed, and they have definitely seen an increase in online exploitation. And so we don't know for sure how much that is yet, but we are constantly looking for ways as the governor's office to be able to support the ICAC division and how we can come alongside them and provide support so that they can address these cases. It's a little overwhelming, but it's important work. And so Texas is committed to doing what we need to do to address it.
And we have partnered with another organization called Three Strands Global Foundation out of California for the Protect curriculum, which we have offered, they have generously offered free of charge for all Texas schools and other agencies that are working with high-risk youth in the state through the end of December. And it provides training specifically for the staff that are utilizing the curriculum, and then also the curriculum itself to assist with preventing online exploitation. So we've had a lot of schools take advantage of that. We're partnering with TEA to come up with they have a gateway module that has not been released yet, but is in the process of being validated for release for training for faculty and staff on human trafficking. So we're doing a lot in this space with schools because we know this is a really important time for us to partner together. One of the other things, Cc, if you want to talk about the great partnership that we had with A21 and the First Lady of Texas around the recent campaign, billboard campaign.
Yes, we do have we lost your video, just so you know. There you go. We do
I'm
have,
sorry.
that's
My
okay, no
battery's
problem.
so I'm going to plug in.
We love technology. Yes, this last year, or actually earlier, yeah, no, last year, we had, COVID has me thinking that everything happened so long ago. We did start a Can You See Me campaign, and it rolled out throughout the state of Texas. It began in Houston, and it really is a powerful campaign. We have several different billboards throughout the state of Texas that really just ask one question: can you see me? And it has a picture of someone on there that is a normal youth, right? Like anybody we would see anywhere. And that's kind of what the whole point of the billboard is so that we can see that vulnerable, exploited youth are among us, and they are doing normal things that we would always do. We're trying to change the stigma of what we paint, the picture of what a person who's being trafficked looks like, and they just look like anyone else. The billboards are both in English and in Spanish, and they're all over the state of Texas. So we had these different press conferences in the cities where they were being unveiled. And so I got to be a part of several of them here in San Antonio and throughout Texas, and that was really a great initiative. I've seen so many people come back and respond and just say thank you for this. We learned so much. But the partnership that was there with the governor's office, and then several different organizations like the billboard companies, like the Drug and Alcohol Administration, just to see everyone coming together saying, we need to put an end to this, and this is our contribution to the public, saying we want you to recognize the signs too, to put it in your face, and as you drive, it's a constant reminder of, let me be aware of my surroundings, let me look around and see if I can see red flags. So yeah, that was a great initiative that was launched. I remember talking about that campaign with several other people who live in different states, and they have started the same thing in their areas through different means and different organizations, but it was just birthed here, and that was really exciting.
That's great. Yeah, it was exciting.
Yeah.
So one of the other things that we're doing around the recovery strategy and the Texas Point Star is we have advocacy agencies, Csa Advocacy Agencies, that provide long-term relational advocacy for victims who are working through their victimhood into survivorhood. And these advocates can stay engaged with our youth up until the age of 22 if they are involved in care coordination, which is another one of the strategies that we're working on. And I'll let Janet tell a little bit about that.
Yeah, so care coordination really is such an important part of our response to this. And when we talk about supporting those victims, those survivors. And so, yeah, we have care coordination teams, as we call them, being developed all across the state. And they do just what they say, coordinate care for those who have been victimized in this way. And they work really hand in hand with these Csa advocates. And Csa stands for Commercially Sexually Exploited Youth Advocate. And these advocates, as Debbie said, are relational based. And we know that these children have been hurt through relationships. A lot of the misconceptions, and I just saw this on Facebook, actually. One of my family members posted a meme about trafficking. I'm like, oh, she still doesn't have it right. Just about assuming that it's stranger danger, which certainly there is that. But a lot of times these kids are exploited by people who intentionally build relationships with them and create this bond with them, so they feel they're no longer a stranger to them. And so we know, in order to ultimately break that cycle of exploitation, we have to break that bond. And so our strategy in Texas is to have these relational based advocates that come in, and they create a bond with this child that's a healthy bond and counteracts that unhealthy bond. And so what they do, coupled with care coordination, who is a team of professionals who are coordinating care and support for this child and their family, and then having them across the state as these youth have traveled. We have a really strong connection and communication across our state that's going to support this child and their family, regardless of where their exploitation happened, and as they go home or as they move. And so care coordination, they're able to provide support to these kids long term. And they ensure that these youth don't fall through the cracks, because historically that's what was happening. If you've ever had any experience with navigating systems, it's really overwhelming. And it's overwhelming for, myself. My background is social work. And so as someone who has not been necessarily traumatized by these systems, but as a trained professional going in to help people navigate systems, it's very hard and very frustrating. And so what we've done through care coordination is create a system that's going to wrap full services around these children and their families, so that it's not so difficult for them to navigate, and that they have the care that they need consistently across the state.
And another great thing about care coordination is the agencies that are involved in that. I mean, we are dealing with medical folks, with the child advocacy centers, with law enforcement, with judges, with prosecutors. So everybody in the community is coming together to form a network around these kids. And it's just overwhelming to be a part of that, honestly, to see all these people coming together that, in the past have been siloed in their own little areas, and everyone is understanding the need to create a safety net for these youth so they don't fall through the cracks, as Janet said, and that we wrap around them and provide what they need as they come in and out, because it's very difficult to once someone is recovered or we think rescued, when you're in a situation where you don't feel like you're being exploited, you may go back to that situation because it's what you know, or that is a family member or your boyfriend. And so it's very difficult for those bonds to be broken, as Janet talked about. And so it's really heartwarming to see all the systems pulling together to make sure that we provide what these kids need to get out.
Yeah, and care coordination puts them on the same page and makes sure that everyone on the team understands the trauma, understands the exploitation, and it's created opportunities to talk, whereas those opportunities weren't there before. And so I think that's, again, why Texas is being so successful in supporting kids through care coordination.
Agreed. And some of the other things that we do in the recovery strategy is provide funding for partnerships with drop-in centers, emergency shelters, and then some juvenile justice-based programs in order to provide places for these kids to go when they need a place to, if they need a shelter, or Bexar County has Centro Seguro drop-in center. It's open 24 hours a day. No wrong door. They don't turn anyone away. So these are avenues that we have to assist youth in the state when they are recovered. Janet, did you want to add anything to that?
I do. Could you tell I was chomping at the bits, because you said that, one of the main reasons, of course, we want to see children healed, right? And we don't want to see our children exploited, but we also don't want to see them criminalized. And we just didn't have options before as a state. We really didn't understand what commercial sexual exploitation has looked like, but we've learned a lot, and we know, and we haven't had options for places for these children to go and get the support that they need. So the default was detention, because in an effort to keep them safe, but because of what Debbie had said, they oftentimes will return because of that bond to that situation. And we want that to stop. So so because there weren't alternative solutions of places for them to go, detention kind of became the default in some areas. And we realize that's re-traumatizing and it's criminalizing. And so we're moving away from that and providing other alternatives. And I just have to say, I was on a call last week with Harris County Juvenile Probation Department, and we fund them to do some work with kids who are in the detention that it's been discovered that they have this history of trafficking. But we also worked really hard with the DA's office in Harris County to get to the point to where they just wouldn't even accept charges at all on minors in this area. And talking with juvenile probation department, they're like, you know what, our numbers are decreasing because we don't have those charges anymore. And so that was so exciting because now we have our law enforcement partners and the DA's office realizing we have alternatives for them and we understand this trauma, and we have the advocates who are replacing that unhealthy trauma bond. We don't need to put them there any longer. And so I just think that's great news. And that's another beautiful component of the model, is that we're working to have other options than detention.
And so the fourth strategy out of the 5-point star is support and healing. So we have worked with the National Human Trafficking Hotline to improve services for victims. And so we have all of our grantees in this that deal with this population and any others in the area that are providing services to fill out an application to become part of the service referral directory with the hotline. Some of these agencies are partner facing and some of them are community facing. And so if anyone calls into the hotline and is looking for services, they can give a zip code, and then they will provide information based on what's in that particular area. They also are providing a warm handoff to people who call in with tips for law enforcement and DFPS. And then helping us track data so that it can inform the strategies that we have around the star in enhancing what we're doing. Did you want to add anything else just to our supportive healing strategy, Janet?
No, other than to say we're continually learning and training and bringing online other partners to be able to care for these youth and their families as well.
Yeah, so we do have long-term residential providers like the Refuge and Bastrop and various other places around the state that provide long-term treatment. And then also some adult service providers as well, like La Mariposa in San Antonio, that provides care for 18 and above for sex trafficking. So we have, we know that it takes a lot and a long time for these survivors to actually feel like they're a part of the community again. And so we need to really do everything we can to provide all types of services, from legal aid to counseling to job readiness. And I don't know, Janet, if you want to fill anything else. I mean, just the list doesn't stop on the things that
housing, just doing a lot of work in just economic empowerment, things such as that, so that as these youth transition into the young adults, that there are systems in place that will continue to provide that support for them. So we're really looking to be completely holistic in the approach for the recovery process.
And so I mentioned earlier on that one of our guiding principles is trauma-informed care. And so we have a partnership with Texas Christian University to provide the Karen Purvis Institute to provide trust-based relational intervention, or TBRI, training to our partners. And so we have many agencies that have been trained across the state, and we're working in systems, schools and juvenile probation departments, even working into the court system for trauma-informed care. Because we feel like that is really, in order for, as Janet mentioned earlier, for kids to not be re-traumatized by systems, we need to understand what's going on with this complex trauma and how to address that.
Yeah, and as well as those systems also into the residential programs that they live in. We have to change the way we've done things in the past, and TBRI has been an invaluable tool in helping us do that.
Yeah. And so the last strategy we have is bringing justice. And so with this particular strategy, we have partnered with Baylor University to provide motivational interviewing. And I know this is one of Janet's pets here. So if you want to talk about what motivational interviewing is, Janet.
Sure. Absolutely. So what we know is that change is hard, right? Whether whatever your circumstances are, change just doesn't come overnight. And so, and that's especially true for our survivors. And so, motivational interviewing is a tool that actually elicits one's own motivation for change. And so we are training our CSA advocates and other service providers in motivational interviewing, understanding that tool, understanding how to evoke within the youth that they're so privileged to serve their own motivation for change, and come alongside them and support them through that change process. It's an evidence-based model. It works, and so we're really excited about that. We really are taking advantage of every tool out there to best equip those who are going to be working with our youth to be able to really support their healing. And motivational interviewing is just another one of those.
And a couple of our other partnerships in this training area of Collective Liberty, who work with judicial settings to provide training around how we can better prosecute these cases and investigations. Also fund NCMEC, the National Center for Missing and Exploited Children, to provide prevention awareness training and also law enforcement training. That's also another really good site if anyone wants to go and get more information about cyber exploitation. It's a fantastic website. Janet, can you think of any other partnerships in the bringing justice arena?
You know, you've mentioned the main ones, okay. And so yeah.
Okay.
TBRI, actually, we're working on a partnership with TCU, the Karen Purvis Institute, and they're creating a training specifically for law enforcement and for the judicial system around working with the survivors when they're prosecuting these cases, or when they're on these sting operations and things such as that, so that they can be well trained to set that youth up in the best way possible for cooperation to bring charges against the trafficker.
And we also have a number of coalitions, trafficking coalitions around the state that provide information on labor and sex trafficking to individuals. And so if anyone is interested in learning more about what's going on in your area, you can see if there is a human trafficking coalition around you. And if you can't find anything, you can always reach out again to that regional administrator off the website, and we can assist you with that. On the website, there is a roadmap for Texas communities, a result of a partnership with the Meadows Mental Health Policy Institute. And this is a really great resource for individuals wanting to learn more about what we're talking about today and how they might start a coalition in their area, what it would look like to work with different agencies around this commercially sexually exploited youth. So it's a fantastic resource. So I would encourage anyone interested, if you're not already connected with someone, or if there's not something in your community, go and visit this roadmap and see what opportunities you might have for leadership in that area.
That's wonderful. Wow. So thank you for walking us through the whole strategy, the 5-point strategy. It's exciting to be a part of all of this going on in our great state. Thank you, ladies, for joining me. I do just want to point out there that if you are interested in looking up the coalition in San Antonio, it's Alamo Area Coalition Against Trafficking, that we're part of A21 Freedom Chasers is, and Debbie is our regional administrator, and there's others. So if you happen to go on the website and look and try to find yours. I know they're more than happy to have sessions like this with you, or to come out and educate, or even just point you back to the resources that are all available online. How do people find all the information? They can just go on your website, right?
Yeah, and that's www.gov.texas.gov/CSTT.